We are delighted you chose to be with us today, and we want you to have a wonderful experience. Please be assured your safety as well as your enjoyment of the event are our utmost concern. Please take a moment, look around, and identify the nearest two exits. Whether in a virtual setting at your home or physically in some formal venue, we must always be emergency ready. So please identify two exits in your current location in the event it is necessary to evacuate quickly and orderly in case of the need for an emergency evacuation. Also, as we strive to continue to stay safe and healthy, please follow the latest guidance from the CDC. Remember to wear your mask when necessary and wash your hands regularly. Greetings, and welcome to today's webinar hosted by the Pittsburgh Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Before we begin, I will be providing a few housekeeping items for our event. All lines have been muted, and to eliminate interruptions, all participants will remain in listen-only mode. If you have any questions for our presenters, please feel free to enter them in the Q&A pane that can be located via the bottom of your Zoom window. Questions will be addressed during the appointed time. Lastly, this webinar is being broadcast live on Facebook. We hope you enjoyed today's webinar, and now I'll turn it over to our chapter president, Helen Bowers.
Good evening and welcome to our webinar, which is being hosted by our Physical and Mental Health Awareness Committee. Our chairperson is Lisa Harris. Our co-chairperson is Jackie Lyde. Lisa will now introduce the topic and presenters for this evening.
Welcome to the live finale of Talking Through Thursdays. Tonight's topic is getting through the holidays. Our presenters this evening are Dr. Channing L. Moreland and Johnnie Geathers, and a testimony by Brenton Dorsey. Dr. Channing L. Moreland is a licensed professional counselor, national board certified counselor, and co-owner of Sanat Counseling and Wellness LLC, a private mental health practice located in Pittsburgh, Pennsylvania. She is also the founder and lead consultant of CLM Consulting, firm where she helps organizations cultivate inclusivity to increase employee and customer engagement and satisfaction. She has more than 15 years of nonprofit experience in a variety of leadership capacities. Dr. Moreland earned her Bachelor of Arts degree in Child Development and Family Relations, Sociology, and Master of Arts degree in Clinical Mental Health, and a Clinical and Mental Health degree in Leadership and Administration from Point Park University, and a Doctor of Education degree in Leadership and Administration from Point Park University. Dr. Moreland holds certificates and certifications in human-centered design, diversity, equity and inclusion, and mental health first aid. Her broad professional experience spans expertise in K-12 education, affordable housing, crisis management, individual and group counseling, mentorship, health equity, diversity, equity and inclusion, and higher education. Dr. Moreland was the recipient of the 2022 Women Who Lead Award, University of Pittsburgh Black Staff Excellence Award, New Pittsburgh Courier Fab 40, and the Community Heroes Award. She is a published author and frequently invited to speak at local and national professional conferences and meetings. Channing is also an active member of Delta Sigma Theta Sorority Incorporated. And did I mention she's a graduate of the Indiana University of Pennsylvania. Johnnie Geathers is a licensed social worker and mental health therapist for Family Links Incorporated and Hand in Hand Counseling Services, LLC. For Family Links, he works with children in a therapeutic classroom environment under Pittsburgh Public Schools, providing individual and group therapy. For Hand in Hand Counseling Services, he provides individual therapy to different populations from children to adults. Johnnie's personality and passion for helping others makes him go above and beyond to help the clients under his care. Johnnie takes a stand to help others outside of his work environment by participating in different speaking engagements, podcast interviews, publish articles in Helpful Living magazine, and through his work of JG Mental Health Fridays. which are video segments that he does on social media and on YouTube, discussing topics that affect everyone and providing coping exercises for individuals to practice on their own time. Johnnie is a member of the Iota Phi Theta Fraternity Incorporated. With the fraternity, he holds different leadership positions on a local, region, and national level, and continues to engage the community through work and service. He has received numerous honors for his work in the profession, as well as with his fraternity, such as the 2020 Pitt Social Work Rising Star Alumni Award, 2022 New Pittsburgh Courier Fabs 40 Award, and 2022 Leader Alumni Achievement Award from Penn State Black Alumni Reunion. He is a member of the Pitt Social Work Alumni Advisory Board and a board member for the Jaquan Lavender Foundation. Johnnie finds a way to stay in touch and involved with the community in every way possible. Now I will turn it over to Dr. Channing Moreland.
Good evening, everyone. Can we cue up the presentation? I think Johnnie is actually going to go first.
Yes, I am. I'm going first. All right, so good evening, everyone. I'm glad everyone is able to be on with us this evening as we talk about different things that could kind of go, that could trigger us up within the holiday season and also prepare for us for the new year. So first off, I want to start off with seasonal affective disorder. So seasonal affective disorder is a type of depression that changes during the different seasons. Most of the time, it mostly happens during the fall. So a main identification factor that happens within this time is during the fall, the weather changes and there's no direct sunlight. So during the fall, some symptoms that happens are we lose interest in activities such as not want to go outside, not want to work out, not even want to socialize and interact with people because of not having that sunlight, and also not even want to do much because it's cold and such. Also with that factors, it triggers on into the winter. And as you all know, during the winter season, we deal with snow, we deal with try to isolate ourselves. So that kind of increases hopelessness, that increases sleeping too much. And also that increases overeating because we eat so much for comfort and satisfaction during this time. As it carries on into the spring, it kind of increases low energy and irritability because we don't have that much impact and inability to even indulge into different things that we really want to do because we complain about the weather, we complain about the time change and things of that nature. And with those symptoms, it carries out into, early summer. And the main thing the reason why it carries out into early summer, because during the summertime, what happens during the summer? The sun is out, daylight savings happen, and that kind of gives us more time to do the different things that we love to do. So for individuals that are dealing with seasonal affective disorder, also known as SAD, we have to pay attention to the seasons, the weather, and also location. As we all see us here in Pittsburgh in the East Coast, we notice that it's getting dark early. We notice that it's getting cold. The weather's even fluctuating. We don't know if it's either going to be cold one day, if it's going to be hot one day. And also there's times that we end up getting sick and stuff. So we have to pay attention to those things. Next slide. So I want to provide some coping skills that can help you if you know someone or even dealing with this aspect of SAD. So first is exposure to sunlight. If you see at least an ounce of sunlight, try to go outside and get it as much as you can. Because with sunlight produces vitamin D, and also with the help of sunlight, it helps to produce different hormones such as serotonin and other things to help refuel and regenerate our body. Also light therapy. So as y'all, like I said earlier, with us not getting that direct sunlight, there might be times that we need to, get different light bulbs in our homes and our offices and different spaces to be able to get the nutrients that are missing from the direct sunlight. And what you can do for light therapy is actually talk to, a professional to see what particular light bulbs that could be used to get that energy that's missing from the sun. healthy eating. As I stated before, with there's a symptom that we overeat, and most of the thing that we overeat a lot the most is carbs during this time of the season. So with healthy eating, just making sure that you're getting all your nutrients, making sure that you're balancing out your carbs, your proteins, and your fats. Exercise. Exercise is really important. I know there's a time where we're like, oh, it's cold outside. I don't want to go to the gym. I don't want to do this, that, or the third. Maybe you could do some stuff at home. Do some sit-ups. I don't want to go. Do some sit-ups. Do some push-ups. Do some, running in place. Just like some little working things to get things going. Vitamin D. The reason why I put vitamin D on here because even though vitamin D comes from the exposure to sunlight, there might be something where you might need to take like supplement pills, and that's where you will have to talk to your PCP to see if there's any things that you can do as alternatives to get the vitamin D. And then lastly, talk to a mental health professional, because sometimes we automatically think that we do have seasonal affective disorder, but with talking to a professional, you might be able to see that it might be something deeper along those lines that might be hindering to why you're not, that your symptoms are increasing. You might not even have seasonal affective disorder. You might be having anxiety. You might have depression and stuff. So it's important to talk to a mental health professional. Next slide. And we're going to take it away to Channing.
Good evening, everyone. Thank you so much, Johnnie, for sharing that really important information regarding seasonal affective disorder. And so we know during the holidays, it can be a very, very tough time for many of us. When people experience depression, seasonal affective disorder, or other mood disorders, as professionals, we always assess for suicide. But also as a layperson, you can assess too. And so in this section, I'll go over how to assess for suicide or harm. I'll also go over the risk factors associated with suicide, warning signs, and how you can help someone who may be experiencing thoughts of suicide. So first I want to talk about, you can stay on that previous slide, thank you. First I want to talk about the risk assessment, right? And so gender. As professionals, we know that gender does play a role when we think about suicide. And so it is true that males often complete suicide more than females. However, females attempt suicide more. And so that's something that we want to keep in mind too. Age. In 2019, the highest rates of suicide among Black Americans are ages 25 and 34. That was in 2019. So this is a topic that affects all people, regardless of race and ethnicity. Chronic physical illness, right? And so if someone is struggling with a medical concern, such as cancer or diabetes or any other major medical ailment, it can also lead to a very low mood, and thoughts of suicide can come up for that person. The use of alcohol or other substances can also exacerbate the feelings of wanting to end one's life, and also mental illness too. And before I go on, I know this is a really tough subject, so I want to make sure that you are taking care of yourself. So if anything comes up for you, if you feel triggered in any way, please do what you have to do to take care of yourself. Take a step away, but I want you to also monitor yourself while we go through some of these topics, because they are difficult to discuss. So also someone who has less social supports can also impact someone's mood too. Someone who is alone all the time, doesn't have a lot of family, that can contribute to someone's mood being really low. One of the main risk factors, right, of suicide is previous attempts. So if you know someone who has had previous suicide attempts in the past, that is someone who you definitely want to, keep an eye out on and check in with frequently, because if there's a history there, their risk of suicide increases as well. And if someone has an organized plan, right? Oftentimes when someone is suicide, they may have a plan of how they want to end their life. And that's something that we want to assess for too. There are also some warning signs of suicide. So of course, threatening to harm oneself, right? Threatening to end one's life, seeking means, right? Seeking access to get whatever it is that they want to follow through with their plan. Talking, writing, posting on social media, that's a big one, right? Many of us are on social media. Many of us see posts of people posting about their mood, about other people, about what's going on in their life. If you see something like that that's concerning, I encourage you to check in with them. If you feel comfortable feeling hopeless, so if someone is expressing feelings of hopelessness or worthlessness or continuous sadness, that's someone you also want to check in on. Actively, and recklessly engaging in risky behaviors can also be a sign that someone's not doing too well. Increased use of alcohol and or drugs, withdrawing from family, someone who has a dramatic change in mood, right? And so if you know someone who historically their mood is pretty low, and all of a sudden one day they're on cloud nine, they think they can conquer the world, right? That could be an indication that something else is going on for them. So when you are talking with someone who is experiencing what we call suicidal ideation or suicidal thoughts, right? You want to let the person know that you are concerned and willing to help. Okay, that's a big one. Just being in a space with someone, holding space for someone, asking someone how they're doing, and offering your support. Maybe it's emotional support. That's really important. Discussing your observations of that person, right? So you can say, hey, so-and-so, right? I've noticed that you have been down a lot lately, right? I've noticed that you haven't been doing the things that you used to do. That is how you express your care and concern. That's one way you can express your care and concern. Asking questions, right, without dread. It's very difficult, even as mental health professionals, to ask someone if they're having thoughts of suicide or thoughts of ending their life. But I want you to ask yourself, what could happen if you don't ask, right? And so asking the question unapologetically, it can save someone's life. I'm not expressing negative judgment, right? People don't want to be in these low moods. People don't want to be in these spaces. And so we don't want to kick people when they're down. We don't want to, tell people they're wrong for feeling the way that they do, but really just being there and listening is really important. So how do you keep someone safe, right, when they are feeling suicidal? So you always want to provide a safety contact number. When we get to the next slide, I'll go over all of the contacts that I'm going to ask you to plug into your phone, because you never know if you may have to use them. Helping the person identify past supports. When someone is in crisis, they're not thinking about, they're not always thinking about who can help them, right? Who's there. So sometimes they may need someone to remind them, right? Have you ever been in a space before? When you were in this space, what did you do to get over this space, right? Or who did you contact? Involve them in the decision making if they are in a space where they can receive that, right? So it might be, do you have a hospital that you want to go to, right? Do you want to go ambulance, or do you want me to drive you, right? So involve them in decision making as much as you can. Call 911, law enforcement immediately if they have a weapon. If you are really concerned about their physical safety and well-being, you want to just go ahead and call 911. Do not leave an actively suicidal person alone. That's the last thing that we want to do, right? We also don't want to use guilt or any threats to try to prevent the person, right, from ending their life. That's not helpful either. And you also do not want to agree to keep, this a secret. Someone is expressing that they are wanting to end their life. It's serious, right? People say, oh, they're just attention seeking. We always want to take that serious no matter what. Next slide. So coping skills to handle, this very difficult and dark moment is creating safety plans. That's something that we do in treatment and sessions, and that's just a plan that identifies, okay, when I'm feeling down, what does that look like? When I'm feeling down, who do I want around me? What helps me when I have a low mood? Who should I contact in times of crisis? Right? And what are your protective factors? Those are those things that help someone, right? Prevent someone from actually ending their life. Okay, so creating a safety plan can be really helpful for someone who has a persistent kind of low mood, depression, other mood disorders. Also seeking professional help. I can't stress that enough. If you are employed and your employer has Employee Assistance Program, EAP, utilize it. I found that is one of the most underutilized benefits that many of us have. You get free counseling services. You can get between 6 to 20 sessions for free. And whoever is overseeing your benefits, they'll help you find a therapist too. So please make sure that you utilize that service. Also, you can call the back of your insurance card and gather a list of therapists. There are a number of websites you can visit. Psychology Today, I would encourage you to go there. You can find therapists all throughout your state. Also self-help strategies. So there are often things that we can do to kind of calm ourselves down, to get us in a better space. It could be walking, it could be reading a book, it could be journaling, right? It could be moving, exercising, whatever that is to kind of help, help your mood increase is something that we encourage people to try too. So these are the numbers I want you to put in your phone. Suicide Lifeline 988. It's only 3 numbers. You can call it and get connected to someone immediately who can help you. They can provide supportive listening. They can refer you to other crisis centers in your area. This is a national number, 988. Crisis Resolve, this is local. So this is for Allegheny County only. You can contact this number for supportive listening. So if you're just having a hard time and want to talk things through, if you're feeling suicidal, you can call them too. They can come to you. They'll come anywhere throughout Allegheny County. I do want to tell folks that sometimes it takes a while for them to get there. Right. And they'll let you know that, but they will help you, get to the hospital. They'll help you kind of calm down. They'll help you create a safety plan. They'll also kind of help you get you scheduled into a therapy appointment too. The Trevor Project, this number is specific to individuals who identify from the LGBTQI plus community. You can contact them via text or phone call, and it works the same way. And obviously, if there's an emergency, you want to call 911. Next slide. Okay, Johnnie will handle grief and loss.
All right. So with grief and loss, there are 5 different stages of grief and loss. And as I explain each of them, I just want to let all of you know that the stages of grief and loss doesn't go in order, because there's different times that people go through different things where they are losing a loved one. So we're starting off with denial. So denial is just an aspect of, denying the situation that a particular loved one has passed on. This is a moment where we question and said, this can't be happening. I don't believe that this person is gone right now. I don't even want to hear that this person is gone right now, because they don't really want to realize that this actually has happened. Individuals in the denial phase, this is a time where you actually have to teach them and kind of give them guidance and tools to let them know that, yes, this actually has happened, and to try to give them steps on how to, move forward through the aspect of losing a loved one. Next is anger. So anger, most of the times, most of us question, why is this happening to me? Why is this happening to this particular person? This person is a good person. Why this person has to be taken away from us at a time like this? And when individuals are in this anger stage, when going through grief and loss, they have difficulty with expressing their emotions. They have difficulty with sharing how they really feel, so they share their actions through anger. Bargaining. Bargaining is a stage where individuals are having their should have, could have moments. So they kind of question themselves and say, oh, I should have did this. If I could have did this, this person would still be living. If I could have said something to this person a long time ago, this person would still be here. So kind of just saying that, you kind of putting yourself in that position of saying that, okay, if this didn't happen, or if I could have made this work, this death wouldn't have happened. And another thing that that stands out with bargaining is we kind of have that statement of, I could have did anything to change this. And we kind of put ourselves into, not saying that we're guilty, but we kind of put responsibility in someone's death, but not really realizing that, no, this, happened for a particular reason and it's not your fault. Depression, as we all know, depression is a moment where it's a path of, sadness. Individuals that are, losing someone, they kind of go through a roller coaster up and down of moments where they say, yeah, I'm fine. And then automatically they break down once they get like a glimpse of a memory, or they see a particular aspect that kind of brings into a memory about that individual that they lost and such. And then there is that question during the depression stage where you ask, am I even going to get over this loss? How long is it going to take for me to get over this loss of losing a loved one? Even if you lost someone for, 5 or 10 years ago, that kind of still lingers on to individuals that still haven't got over that loss. And then acceptance. Acceptance, that is the final stage of grief and loss. So with acceptance, that's actually when you kind of did the work and you logically understood that the loss happened, but you could be able to process it and move forward and kind of say to yourself that it's going to be okay, and I am okay that this person moved on into eternal life. But again, like I had stated earlier, is that with these stages of grief or loss, it doesn't go in order. It can happen at different times in different stages of an individual's life based on how they grieve over someone. And now I'm going to talk about the coping skills for grief and loss. Next slide, please. So the first aspect, so what I did with these coping skills with grief and loss, of which I did this with some former clients of mine, and I broke it down within each stage. So with the first stage, with denial, you could do the 5, 4, 3, 2, 1 technique. With the 5, 4, 3, 2, 1 technique, that is a grounding state, a grounding exercise that you can do for individuals to just get them into a present space. So they're not focusing on the past, they're not focusing on the future, they just focus on being in their present self. So with 5, that's basically with 5, 4, 3, 2, 1, you're basically using your 5 senses. So with 5, you're thinking about 5 things that you can see currently right now in your present space. 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste. And with using your 5 senses, that can help you to be able to just bring your awareness to yourself and bring you to be more present within yourself. With anger, what you could do is journal your feelings. As I had stated before, with anger, there's a difficult time where we don't really know how to express our emotions fully when we lose someone. So if you're going through a pile of emotions and you're building it up, just write it down in a journal, just where you could be able to have a release within yourself. And also, when you're journaling your feelings, if you have that ability and that comfortability to say, okay, I'm ready to tell someone how I'm feeling, even if you're going to a professional, you could be able to have that journal by your side as a backup to say, okay, on this day, I was feeling this way because these things happen. With bargaining, what you can do is you could write a letter to your loved one. So remember where I had said that with bargaining, we kind of feel guilty in the sense that that person is gone. But with writing a letter to your loved one, you could be able to just pour out your emotions and just say how you feel about them being gone, but also you can write about the good times and the memories that you had with that individual. And also with that letter, you could keep it as a keepsake within yourself. So if you kind of feel like you're down or you're having thoughts about someone that you lost, you can read that letter over and over again just to give you that comfort and that ability to, manage your emotions. With depression, what you can do is 3 good things. And 3 good things is a technique that you could practice on a daily basis. And what you have to do is just identify 3 good things that happened today. So I'm gonna give you an example for me. 3 good things that happened to me today. 1, I woke up. 2, I'm here presenting to all of you. And 3, I was able to talk to all my clients today. So those are 3 good things I can say about myself. So, you can practice that every day for you. And then lastly, with acceptance, you could do the accepts technique. And accepts is an acronym, and that acronym stands for activities, contributing, comparisons, emotions, push away, thoughts, and sensations. And the accepts technique is a distress tolerance exercise that can help you to just eliminate distractions and to help you push through your emotional situations. So with activities, you could think of different activities that can help you to decrease your emotional levels. So if you know that your energy is down, maybe what you might want to do is talk to a friend. Maybe you might want to go for a drive. You might want to go for a walk. Those are some activities that can help you to manage your emotions. With contributing is an aspect where you could say that what can you do to pour into someone? And what you can do as an example with pouring into someone is maybe volunteering at different places, helping people out in your community, just to be able to give that pouring of love to someone. Comparisons, what you can do is just compare yourself to other individuals that went through the same situation that you went through in terms of grief and loss, but also see how you can grow from it. Emotions, this is where you actually just identify what emotions you're going through during this time in your life. Push away. Push away is a moment where you just address the different things that you are trying to push away, but seeing what strategy that you can do to just take it a step at a time to eliminate it. Thoughts. This is a time where you actually identify what thoughts are coming into your mind when you're thinking about that particular loved one. What memories pop up in your head? What sensations had came into your psyche about this particular loved one that you could be able to address? And then with sensations, this is basically pay attention to your five senses and see how your five senses are impacting you as you're going through, your grief and loss, but also how it's impacting you with you moving forward into your own life. Next slide. Now I'm gonna give it to Dr. Moreland.
Okay, so we will conclude the mental health kind of portion before we get to Brenton anyway, regarding eating disorders. So I actually started my career working at Western Psychiatric Institute and Clinic, that's what it was called then, on the COPE unit. So it's called the Center for Overcoming Problem Eating, which is a unit within Western Psych that really supports adults and children struggling with eating disorders. In my experience, just working as a mental health professional, we don't talk about eating disorders enough, especially in the Black community. Eating disorders affects all people. It can affect all people of all ages. Doesn't matter your race or ethnicity, your background, body weights, and genders. It's definitely a condition, a disorder that can affect many people in many different backgrounds. Eating disorders are actually one of the most serious and often fatal illnesses, and I'll get into kind of why that is in just a few. Eating disorders is typically associated with severe disturbances in people's eating behaviors. Also can impact someone's thoughts and emotions as well. It's a preoccupation with food, body weight, shape, may also kind of signal an eating disorder. Eating disorders, although they're frequently seen in teens and young adults, it can also develop during childhood or even later in life too. The common eating disorders that I will review this evening is anorexia nervosa, bulimia, and also binge eating. So anorexia nervosa is a condition where people avoid food, right? They avoid eating, they restrict, severely restrict food, right? So they limit how much food they eat, or they eat very small quantities of food and only of certain foods. Sometimes people manipulate the food and put it in water or juice, right? To change the consistency and the texture of the food. Someone who struggles with anorexia may weigh themselves repeatedly or, over-exercise, right? And they can become under a very low weight as well, right? So they can be dangerously underweight, and they may see themselves as overweight, right? And so that's the psychological, the thought process that individuals may carry who experience anorexia. Again, anorexia nervosa can be fatal, right? It is said to be kind of one of the deadliest mental illnesses because it impacts us medically, right? There's a high death mortality rate compared with other mental disorders. People with anorexia are at risk of dying of medical complications associated with starvation. So if you're not feeding your body, it's going to affect you cognitively. So that whole saying of being hangry, that's a real thing. If we don't eat, right, it affects us mentally and also physically. Or organs can shut down when we're not eating. So eating is really important. And if someone is struggling with an eating disorder, it's even more important to get them help. There are a number of symptoms associated with anorexia nervosa. So again, extreme restricted eating, very thin as well. This kind of relentless pursuit of being thin and a very intense fear of gaining weight. Some of the medical complications that can occur over time is thinning of the bones. So developing osteoporosis, having very brittle hair or skin, very hair and nails, brittle hair and nails, dry or yellowish skin. Severe constipation, low blood pressure, someone can become anemic, right? Very slow breathing, a very low pulse. It can damage the heart. It can damage the brain. Feeling very tired all the time, and it can also lead to infertility as well. Bulimia is a condition where people have recurrent and frequent episodes of eating very large amounts of food, right? And feeling this lack of being out of control when it comes to eating, followed by behavior that compensates for overeating, right? Such as vomiting, right? And so if someone is overeating, to kind of get rid of that, right? There's feelings of guilt. And so people may force themselves to give up the food. They may take laxatives, so overuse of laxatives, fasting a lot, and also excessive exercise. People with bulimia may be slightly underweight. They could even be a normal weight, or they can be overweight as well. Some of the symptoms is, this chronically inflamed sore throat, right? And that usually is developed because of the forcing oneself to give up food. Increasingly sensitive and decaying teeth. Again, that contributes to the giving up of food, acid reflux disorder, intestinal distress or damage, severe dehydration, right? And also an electrolyte imbalance, right? So too low or too high levels of sodium, calcium, or potassium, which can also lead to a stroke and heart attack. Right. And then we have binge eating disorder. And this disorder is a condition where people lose control over their eating and have reoccurring episodes of eating, again, large amounts of food. And then people, again, intentionally give up their food. Binge eating is actually the most common eating disorder in the US. And some symptoms are eating even when you feel full, right? Or eating fast, eating until you're very uncomfortably full, eating alone or in secret places to avoid people seeing you or to avoid feelings of embarrassment as well, feeling distressed, ashamed, feeling guilty, frequently dieting, right? And possibly without even losing weight. Okay. And so you can go to the next slide. So, there are a ton of coping skills, but I really believe, as a mental health professional, as someone who worked with this population, the most important thing that needs to happen is someone seeking professional help, right? This is not, when it gets to be chronic, this is not something that someone can just control by themselves. Right. So it's important to seek treatment early for eating disorders. People with eating disorders are at a higher risk for suicide and medical complications. Okay. People with eating disorders can often have other mental disorders, right? And so we say that, individuals can have mental illnesses that co-occur, right? Happen at the same time. So it's true that someone could experience an eating disorder and have depression and have anxiety. Okay. Treatment plans are tailored to the individual. And so if someone is struggling with an eating disorder, they may go to a counselor, right? There are a lot of evidence-based treatment programs that are group-centered as well. Someone may be required to go into a medical hospital and get medical care before they can go to any type of mental health facility to get treatment. Nutritional counseling is almost always involved, right? And so pairing someone up with a nutritionist and coming up with kind of an eating plan is all a part of that as well. And medications might be helpful too. With everything that we share today, recovery is possible. Say that again. Everything that we share today, recovery is possible, right? Just because someone may be experiencing SAD doesn't mean that they have to experience that their whole life. Just because someone has an eating disorder doesn't mean they have to experience that their whole life. Okay, there is treatment out there, therapy works, and you don't have to do any of this alone. And so with that, we are going to kick it over to Brenton to share a testimonial regarding his mental health journey. Thank you.
Hello, everyone. My name is Brenton Dorsey, and I am from Pittsburgh, Pennsylvania. I just came back from California, and I'm a filmmaker. The reason why I've been given the opportunity to speak from the beautiful women of Delta Sigma Theta Sorority Incorporated was due to the fact that I have been a patient of Dr. Geathers for a little bit after last year. I'm currently going through the holiday blues, as they call it, or SAD, as they've professionally named it. Last year, Around this time, I lost my grandfather, who was a very big part of my life. And it was the first day of my semester of my master's degree. So when you put all that together, it was a really hard time for me at that time. And speaking to my friends who really couldn't help me through the thick of it, I decided to reach out to Johnnie through mutual friends. And me and him having a relationship beforehand, running into each other really helped ease my anxiety to speak with him. It really helped me through, the anger and the frustration that I was experiencing being halfway across the country when my grandfather passed away. Feeling those emotions of not being there, of wanting to be there, feeling like I let him down, were things that I had to work through. And without Johnnie's help, I don't think I would have been able to do it. So that is another reason why I'm here to give anyone that is going through a very tough time this year, or the past couple of years, due to everything that we've gone through with COVID, to really reach out and talk to a therapist, talk to a mental health professional, because this is really something that I personally never thought I would go through. I thought I was more mentally strong than a lot of people, dealing with everything that you deal with life. But this was something that, once you hit that wall where no one can really guide you in your emotions, it's the best time to talk to a professional. And I don't think I would have been able to do that if I wasn't given that advice, as well as if it wasn't for Mr. Geathers being so open and us having that relationship prior. So to anyone who's experiencing feelings of grief, or someone who is, just feeling isolated around this time, I really, really, really advise you to reach out to someone of the mental health profession to help you through this time. It helped me a lot, and hopefully it helps you. And now I will pass it over to open the floor to anyone who has any questions for Professor Moreland and Mr. Geathers.
Okay, it looks like we have a question. The first question is, there's often a gap in education about mental health amongst older generations. What are the first steps towards educating these groups about mental health and its realities?
That's a good question. It can be a difficult question to answer too, because people have to obviously be in a space to be willing to receive the information. I think there's a lot of opportunities in the community where there's a lot of people talking about mental health more often than not. More so than when I, first entered into the field of mental health. But sometimes also it's our young people who are the ones who are carrying those messages of what mental illness is and what it is not, and the difference between mental health and mental illness, because those are two different things. We all have mental health. We don't all have mental illness. And so I guess my recommendation and suggestion would be, if there's ever opportunity where there's a forum like this, right, invite them to attend with you. During gatherings, normalize having conversations related to mental health and providing that education, giving them pamphlets or reading materials, or again, bringing them along with you to different events can be really helpful. But the person has to also be willing to receive that information too. Johnnie, do you have anything else that you want to add?
No, I was going to agree with that as well, because within the older generation, they kind of don't really know the aspects of what mental health is all about, because automatically they think of diagnosis, they think of
Medication.
automatic label and stuff, but really overall mental health is basically your well-being. It's how you deal with things in life and such. So with us going to these different spaces and talking to them about this is what mental health is, this is what, different factors that contribute to mental health, then that could give them a better perspective to say that, okay, it's okay to talk about it and I shouldn't be ashamed, to talk about it. And like Dr. Moreland said, you can go to different functions, have networking events. This platform here in itself is just a indicator that, individuals, regardless of what age, can actually learn more about mental health and then actually kind of take a, self-evaluation within themselves and say, okay, what is something I could work on within myself just to have a betterment for me, myself?
And also, if you are someone is in counseling already and they're struggling with connecting with a family member, or a family member may be contributing to kind of what's happening, invite them to counseling with you. Talk to your therapist, talk to your counselor and say, hey, I really want this person to be a part of my treatment. And you and your counselor can talk about how to integrate them into treatment, how to approach them, how to include them, right? And how to educate them too on what's happening with the person who is actually seeking treatment.
Excellent.
And before we go to the next question, I do want to put a disclaimer out there. I know what Brenton called me doctor. I'm not no doctor, y'all.
Not yet. Not yet.
I ain't ready for that yet.
He's just Johnnie, and we love Johnnie. Okay, next question. The next question is, there is an obvious disconnect between mental health professionals and the Black community. What are some ways we can rebuild the trust lacking to improve mental health awareness in the community?
Another good question. Where I sit, I honestly believe that conversations are happening in the Black community more often than we may think around mental health. Again, when I first got into the field over 15 years ago, we weren't having these conversations very much. There are so many platforms now. There are so much more clinicians of color. We're still very short, but there are more clinicians of color. There are so many different more initiatives now. There's a wellness collective. Pittsburgh Brown Mamas is doing work around mental health. I mean, Hand in Hand, tonight. Like there's so many Black clinicians and Black organizations that are really amplifying the voices of Black people and Black mental health. So if you're not plugged in, follow some of those platforms. I'll be happy to connect with whoever asked that question and send them some websites or some events. But again, normalizing the conversation around mental health, right? And so we can do that by, how when someone asks you how you're doing, what do we typically say? Oh, I'm fine, right? When we're not fine. So let's normalize being honest about how we're feeling in the moment, right? Because you'll be surprised that somebody might be feeling the same way, or somebody might offer support or care for you. But really getting comfortable with those conversations and talking about and being honest about the spaces that we're in are really, really important too. Johnnie, do you have something else to add?
No, I was going to say, when they were saying that there's a disconnect between mental health professionals and, the Black community, it just the aspect of just seeing that which professional are you looking for? Because there's a moment of time that we kind of get stuck on saying, okay, I'm gonna just stick with this one professional. But really, if that professional is not really giving you what you need, it's okay to move on to the next professional and everything, and stuff. It's just like how we, shop for cars and shop for clothes and shoes and stuff like that. We can do that with our own professionals and everything. Also in the aspect of like that disconnect, I hear a lot about the aspect of saying that, oh, there's not enough of us in this field, but there is enough of us in this field that is actually doing the work. And we have to, you have to do your research and just look at the different aspects, like on Psychology Today, go on social media, and even talk to somebody in your in your community to say, do you know so and so? Can you tell me more about this person? And do your research.
Still Smiling is also another amazing organization that promotes Black mental health. Julius Boat, right? Shout out to him. There are a lot of mental health advocates out here. And so again, whoever asked that question, please connect with me and I will connect you to some people who are doing really amazing work in this field.
Fabulous. Next question. Someone wants to thank you, Brenton, for sharing your story about Johnnie. Johnnie mentioned light therapy. Can he say a little more about what that entails? Is it something we can do at home? And are there any specific lights that he recommends?
Yeah, so in the aspects of light therapy, more so with it, you have to talk to your mental health professional about it, or even you can talk to your PCP about it as well to say, I'm going through this particular moment where I need more vitamin D, I need more aspects of light, and what are some lights that I could use in my particular home setting or in my office or other things like that. And they can tell you these particular lights that you could find. And it's more so simple. You could go to Home Depot, you could go to Lowe's, and they will have on the boxes particular lights that you could get into for enhancing, enhancing the structure for to get the light therapy. Even you could go on Amazon too, but it's more so first to talk to a professional to see what's beneficial for you to be able to do light therapy. And I can say with the aspect of light therapy is I could say it's an inexpensive cost, depending on what particular light bulbs you're really looking into.
Because I myself got some fluorescent lights. They actually helped me brighten my room up a little bit more. I know you can't see it due to the fact that I got a background, but I did buy some fluorescent lights, which were able to help.
Great. Next question. Knowing the stigma of Black men not wanting to speak up related to mental health, what are some steps we can take to begin to make men more comfortable to do so and foster a safe space for them?
I can answer that one.
Yes.
All right. So as a Black man in this profession, we all know that it's a hard time for men to, one, express how they're feeling and even saying that they're going through something because of two things: ego and pride. What we have to do is, when it comes to having our men be open to saying that, okay, I need help, or I need to, say what I'm really feeling. We got to have the space be more comfortable for them. We have to meet them where they are. We have to, not have that stigma to say, oh, you're going through this, you're saying this, this is how you're feeling, you're weak. We quick to tear somebody down, but we have to be able to strengthen the men right now, because within men there's a power construct, and they kind of feel as though, oh, if I'm going to talk to a professional or anything like that, that kind of diminish my manliness. But in a sense, we got to say that no, you're just strengthening yourself as a man, because you are acknowledging what you're going through, you're acknowledging what your emotions are, you're acknowledging what different hindrances that you're going through, and you try to just make yourself become better. And what it is that has to happen more to decrease the stigma with Black men is just having more spaces for Black men to even talk about different things. I know Julius had did this one time way before the pandemic happened, and he had me on this panel where we had different men in the community come together just to talk about what they're going through, talk about their feelings. And it was a safe space. They was comfortable and vulnerable to share what's going on. And also we had to remind them that this is confidential and stuff, because sometimes there is a lack of trust that happens in sharing what you're actually going through. But once you build that rapport with that individual, they could be able to say, okay, I could be able to let my guard down, say what it is, but then still know who I really am on the inside.
And to add to that, I'm sorry.
Oh no, go ahead, Ms. Shannon.
I was just going to say, the question said, how can we make men, right? We can't make anyone do anything. However, it's important to meet people where they're at. I think when we press men and we, force men to talk when they're not ready, that can cause folks to shut down too. And so meeting people where they are at, and also starting, at the child level, right, with young boys. When I grew up, I have a brother, and my brother wasn't allowed to cry. You know, if he cried, my mom like, what you crying for? You know, stop crying. You too big to be crying, right? We kind of stress, we send those messages at an early age, and then boys grow up to be men, and they grow up not being able to effectively express their emotions, right? Because they weren't allowed to as children. And so we have to allow children to be children and to cry and to feel their emotions and to ask them, you know, not go beyond like, you know, how was your day at school today? But what made you sad today? What made you happy today? Normalize talking to children about their emotions, right? Which will help them grow to be healthy adults. Brenton.
I was going to say, as a Black man, you know, finally getting the therapy that I needed, I honestly wasn't as open to just going out and talking to a therapist. What really got me to speak to a therapist was the rapport that I had with Johnnie through the mutual friends that we had. I knew that he provided mental health services. I understand that, you know, a lot of us aren't really trusting, as Johnnie said before, to just bring everyone into our lives and say everything that we were going through. I would say the best advice that I got, even from Johnnie himself, was that it's okay for a therapist, for you to be with one therapist until a certain point. You can move on to another one that might be able to push you further along to the goal that you need. But you have to take those steps, and you have to be comfortable enough to share wholeheartedly with your therapist so that they know what's going on. A lot of times, even with the first 2 sessions that I had with Johnnie, he could tell that I was giving him, you know, parts of myself, but I wasn't giving him myself fully, and not being completely 100% honest with him with my emotions and with everything I was thinking. And he was able to dig that out because of our relationship. So understanding that, you know, this is a trial and error process with therapists, but also knowing that you have to be as honest with each therapist to get what you need, because if you're going to half-ass it, you're going to get a half-ass result, and you're going to find yourself back in the same position, needing to talk to this therapist again. And that is the best advice that I could give about creating the spaces, is that just making yourself comfortable, not only in your own skin, but with whoever you decide to share yourself with.
I know we're running short on time. There was a question here, I think is it Quintina Thomas? I'm sorry if I messed up your name, but this is a really good question. What are your thoughts on African Americans seeking a therapist that are from the same cultural background? I often hear how non-Black people don't understand this concept. Do you think having the same background is imperative? Really great question, right? Because, you know, there is increase, right, of Black people seeking counseling, which is amazing. There's also an increase of Black people seeking Black counselors, which is also amazing. There's not many of us. There's more of us than there were. There's a lot of us doing the work. But I truly believe that you do not have to go to a Black therapist to seek counseling, to get support, to get help, right, to make changes within your life. Is it helpful? Absolutely. Is there kind of that relatability factor? Absolutely. But it's not necessary. I don't want someone to not get mental health support because their therapist is not the same ethnicity or race as them. Johnnie, do you have anything to add to that?
No, I definitely agree with that, because you know, we automatically go to someone because, oh, we kind of click, they the same culture background as me and stuff. But then when you get more into the relationship rapport building of it, you kind of like, oh, this is not what I signed up for and stuff. So, you know, that's why it's important to explore more of what you want from a professional, and also what you need within yourself. Because the thing is, you don't want to get too comfortable in something and then you're not making your progress. Because then you're losing time. Also, another thing with losing time, you're losing money. Even if some people using insurance for therapy, but there are some times that most people might be paying out of pocket and stuff. So
yeah, and I think, you know, Brenton might have spoke to this too. You know, when you are seeking a counselor, you're interviewing them too, right? You can ask some questions. You have a choice, right? You can say, if they're not of the same race or ethnicity, what is your experience with counseling people of my cultural background, right? What are your culturally responsive practices that you utilize? Right. It's okay to ask those questions, and you should be asking those questions. I used to teach at the University of Pittsburgh, and I taught, students who aspiring to be counselors, and most of them were predominantly white students, right? And I'm teaching them how to be culturally responsive, how to implement culturally responsive practices, how to practice cultural humility. And so those are things that students are learning in school. Now, is it true that, not all medical professionals are culturally responsive? Absolutely. Those aren't the people for you. That's why we have to do our due diligence and ask those questions up front. But please do not let someone's race and ethnicity stop you from getting the treatment that you need and deserve. There was also another question about a Christian counselor. I do have a recommendation, Dr. Mary Purdue. She is a Black woman. She's out in Greentree. I don't believe she takes insurance, but her cost is minimal. And I know her personally. I find her to be a good Christian counselor. FYI.
Okay, Channing, there's a question in the chat. If you can address the question in the chat.
What's the what advice do you have for someone struggling with the stigma of being a strong Black woman? A strong Black woman is of just, yes, I speak to this a lot. That the whole strong Black woman schema, it is debilitating for us as Black women. We don't always feel strong, nor do we have to be strong, nor do we always want to be strong. And so when someone calls you a strong Black woman, I would certainly address that, because it's not helpful to us at all. And it's okay for us to be vulnerable and to say, you know what, right now I'm not okay, right? It's okay to say I'm not okay. And it's okay to not be all things to all people. I think as Black women, we have to do better with saying no, right? No is a complete sentence. Again, no is a complete sentence. We don't have to explain ourselves all the time. And we really need to work on creating those boundaries with people too, right? Not allowing people to just do anything, say anything. We have to teach people how to treat us in the workplace, in our personal lives, with our children, all of that. And so, it is a struggle, right? Because we are socialized to be these strong beings and to accept and handle more than what we should. But we have to also take responsibility for that too.
Fantastic. Well, thank you, everyone. That really is our time for this evening. It has been wonderful. As always, Dr. Channing, Moreland, and Johnnie, you can put your information in the chat so that people can reach out if they have the need to have some of their questions that we could not get answered this evening. At this time, I will turn it back over to our president, Helen Bowers.
Thank you. Thank you, Brenton Dorsey, for your testimony and sharing your story. Thank you, Johnnie Geathers, brother of Iota Phi Theta fraternity, for engaging with Dr. Channing Moreland, my sister in Delta, in this very relevant topic. Now, if you all please check your emails for a survey, we would like to hear from you about tonight's topic. And those on Facebook, thank you for your comments. Also, check up on our upcoming events for 2023. Join us on Saturday, January 28th, for No Is Not Your Average Bingo Party that will take place right here in our virtual platform. Saturday, February 4th is our Western PA Black Homeownership Forum. Will take place in person at Petra International Ministries in East Hills. And lastly, Pittsburgh Alumni Chapter has scholarships. Please scan the QR code to access the information for the scholarships, to attend the home ownership work forum, and purchase your ticket for the virtual bingo party. Thank you again for attending, and have a good evening. And the weather shows it will be sunny in Pittsburgh tomorrow, so plan to get out and absorb some vitamin D. Thank you again, and have a good evening.